a first residential memory care facility to have the goal of returning cognitively declined patients to independent living. And you say that you work with personalized treatment plans and sensory stimulation, engaging activities, and intensive cognitive therapies. Talk to us about just how fundamentally different this approach is than what would happen to a patient who was placed in a nursing home.
Yeah, so typically this is a really challenging decision for any family, for anyone. You never hear anyone saying, oh, I can't wait to go to my nursing home. I can't wait to move into memory care. And what we expect when somebody does go to a place like that is that they're going to go downhill, that this is basically a place to park them, to keep them safe until they die. And it's torture. It's so hard. It's so labor intensive. It is just so heartbreaking. And what I was seeing in my clinical practice in 2017, I was trained by Dr. Bredesen, and I came back to my clinical practice, and immediately I started seeing even severe patients get somewhat better doing this approach. The people who couldn't get better were the ones who couldn't do it. They couldn't implement. And I had a woman who reached out and asked, hey, my dad was diagnosed with dementia. I want him to get Dr. Bredesen's approach. This makes so much sense to me, but I've got a full-time job and kids I need to raise and a dog and a husband and a house. And I can't do it all.
Sure.
So help, where do I send him? And I realized that day that there was nowhere to send him, that there was no place providing an immersive experience in Dr. Bredesen's approach. And so I thought to myself, how hard could this be? And 9 months later, we had a care facility. And so it's the answer to all of those women who are calling me saying, I want this. I want the best care for my parent or my spouse. Where can I send them to get this immersive experience? And, we've attracted people on all ends of the spectrum of dementia over the past 4 years. And some have decided it's the best place. They want to stay long term. They've been there 3-4 years. Their cognition gets a little better. Life happens. It gets a little worse. They get COVID. They have a fall. Something happens. But it works for them and their family. They feel like it's the best place to get super healthy food, to have great care, to be cognitively engaged, and to live the best life possible. And then we have other people who move in and they come for 6 months and they return to independent living. They come, they get an immersive experience, they get a deep dive, they learn how to cook the meals, they learn what a day should look like if you're optimizing cognitive function and the exercises and the engagement. And then with that, they move home with those tools and with improved cognitive function. And that is our real goal, is that people can delay or prevent the need to ever move into memory care.